My name is Dr. Brandon Thornberry. I'm one of the veterinarians partnering with your veterinary hospital and wanted to share a veterinarian's point of view of our approach to the vomiting dog. It's a very common reason why we see pets coming into our veterinary hospital, and by inviting you into this process of understanding our approach and our mindset, you can ask really good questions to your veterinary team and then get the best care for your pet. So the first thing that most cases start off with is asking a really good history, because we can't ask our pets what's going on. We're reliant upon your observations. My acronym for my history taking is DEMO. D stands for diet, so what diet is your pet currently on, or any new changes in that diet, or potentially eating anything that maybe could have been non-dietary related. E stands for environment, so any other pets in the household having similar symptoms. M stands for medication, so any meds that we're currently on or maybe been given for vomiting that have worked or not worked. And then O stands for other symptoms. Not uncommon for us to see a dog that's vomiting and having diarrhea, or vomiting and have a loss of appetite, or vomiting and having some weight loss. Those are a number of things that can build a picture for where we take things next. We'll definitely focus on a good thorough physical. We'll do head to tail physical. There's a number of things I can look at. So if I lift up the gums, I can see the color, right? Should be a nice Pepto-Bismol pink color. I can also get a feeling for if they're pretty dehydrated or dry. The next thing I can look at is kind of the pallor of their eyes too. So it should be a nice white color. If there's any kind of yellow hue, that can suggest a problem with the liver. Take a good feel of their lymph nodes, which live right beneath their jaw. There's also other lymph node kind of tracks and chains that I feel right in front of her arms. I do a nice kind of skin tense, what we call it, so it should bounce back in place like a rubber band. If it kind of stays up in one place, that could suggest dehydration. You can take a good listen to the heart and lungs. Fast heart rate sometimes can suggest abdominal pain or dehydration. Sometimes if they're really dehydrated, they can have a murmur. Some pets that are vomiting can basically inhale some of that vomiting, so I can also listen for crackles in the lungs, make sure she doesn't have any pneumonia. A really good belly palpation is also an important feature, right? So if she's nice and soft and everything feels normal, there's nothing uncomfortable, that's a good sign. If there's anything that seems distended or painful, obviously I want to take note of where that location is. And then typically we'll also kind of check under the tail, potentially even do like our rectal exam to make sure that we're uncovering kind of what's going on, making sure we're not seeing any diarrhea developing too. In terms of diagnostics, typically we start off with one of three diagnostics. Usually the first is a stool sample. So a stool sample can screen for really common parasitic causes for a dog to have vomiting or other symptoms. It's a very easy and simple test to do and can give us an answer many times. The next common test is abdominal radiographs, or abdominal x-rays. This is for the reason being that a dog that's vomiting because a treat did not settle well in its stomach can also look very similar to a dog that's vomiting because it got into the trash that we were unaware of, right? So we take abdominal x-rays to look at the intestines and the stomach to make sure there's nothing that should not be there, and look at the architecture of things that we can't always feel outwardly on our physical to make sure everything looks okay. The next part of the common diagnostic triad is blood work, for the reason being that causes for vomiting can originate outside of the stomach and the intestine. They can originate from the kidneys or the liver. There can be electrolyte abnormalities. There can be white blood cell elevations or decreases that can give us a picture of maybe the origin of the vomiting taking place outside of the stomach or the intestines. There are certainly other diagnostic tests that we can run if your pet has more chronic symptoms that can include abdominal ultrasound, endoscopy, more targeted kind of viral or kind of organ function tests. But those are kind of the initial triad that we wanted to talk about. In terms of treatment, we're always best guided on treating what we've diagnosed with our diagnostics. And after performing those initial diagnostics, we can then cater your treatment for your pet. This can range from giving anti-nausea medications, either by mouth or injectable, if your pet can't hold things down. Oftentimes there's kind of a bland diet or kind of a dietary reset to make sure things are really easy on the tummy. And then potentially some pets might need some fluids if they're dehydrated. We might give those fluids under the skin. We might give them through an IV catheter. If pets are really sick or battling multiple symptoms, it's not uncommon for them to need to stay with us for a short period of time until they're better suited to be able to go home with you and holding things down. And then certainly if pets have a surgical need to correct the source of their vomiting, they might need to stay with us for surgery and hospitalization. The main things we want to touch on though were the importance of a really thorough history, our focus on a physical, that initial diagnostic triad of doing a stool sample, abdominal radiographs, and blood work, and then how treatment is always best guided after we've done those initial diagnostics to diagnose what the true problem is.